But let's just define what is BFR? What's blood flow restriction training?
So blood flow restriction is actually a misnomer, but that being what it is. What it is basically putting bands on your upper arms or upper legs. And in the case of Katsu, those bands actually inflate and deflate using a certain algorithm. And that actually keeps blood in the limb. So it may, and I have one on my arm here. I don't have it on this arm. So I have one arm on and one arm without. And you can see, I hope,
Yeah, there's a difference in
there is a
color.
big difference. What happened, this is my normal skin color, and this is what we call our Katsu color. You can see it's rosy, it's pink here. What's happening are these bands inflate and deflate. And what happens is the blood goes in normally and is being slowed down temporarily every 30 seconds. And what that does, it actually enables the muscular tissue, the ligaments, the tendons, and the bone in your arm to be in a condition where it thinks it is, and it is actually working out. Even though I'm sitting here talking to you, this arm, metabolically speaking, is working out. This arm is just in what we call homeostasis, just hanging there. So that is blood flow restriction, the ability to modify blood flow in and out of the arm in order to affect change, metabolic biochemical reactions in the body that will effectively replicate vigorous exercise.
And so with the restriction, is it arterial restriction? Is it venous occlusion? What is
No,
happening there?
yeah. So what's happening is that this is sort of a band, and it's without my arm. And
Yeah.
this band has an internal air bladder inside, and it inflates for 30 seconds and deflates. Even when it's inflated, the arterial flow, so the flow from your torso out to your hands or feet, continue unimpeded. The blood is going in. But when that band inflates slightly, and it's only a slight inflation, it means it's compressed, that the venous return or the blood from your hand or feet back to your torso is slowed down. It's like a damming, a minor damming effect on your upper arm or upper leg for 30 seconds. And so that venous return is modified. That's what the scientists and doctors say.
Okay, so there's this damming effect where the venous return back to the heart is being slowed down. And
Correct.
then for the muscle that is being where we have the bands on it, what is the mechanism of action? What is you mentioned there's this metabolic, it's almost like your arm is working out. Right now you're passive, you're
Right.
not like doing a bicep curl,
Right.
but there's this metabolic change or effect that's happening in the arm with the band on. What is the metabolic effect that's going on?
There's two effects, two fundamental effects. One, as you can see with my hand. So now my hand is even redder, and
Yeah.
the reason why is the pressure increases incrementally. So this hand, this forearm, you can sort of see the difference here.
Yeah.
This forearm here, what's happening is all the capillaries there expand and contract, expand and contract at a greater degree than normal. So the capillary tissue here is actually expanding more so, very much similar as if I was doing push-ups, as if I was running, as if I was lifting weights. I'm just sitting here. But when the vascular tissue expands, you have some effects such as the production of nitric oxide, the production of vascular endothelial cells. You're actually making your vascular tissue more elastic, more pliable. It's enabling uh, or it's improving the blood circulation in your extremities. And that's very important if, let's say, you have an injury, you have tendonitis, you have a broken bone, you have a cut on your arm. And all of these things, improved blood flow helps. That's effect number one. Effect number two is when you do slight movement, and in this case, I'm just talking with my hands, but I could be holding a book, I could be walking my dog. I could be folding clothes. I could be typing on my laptop. All of those micro movements are leading or are creating a buildup of lactate, very much like if you're lifting weights, building up lactate very mildly, very slowly and gradually in the arm. When that happens, a signal is sent to our brain through our central nervous system. And then the brain believes that this arm is working out vigorously. When that happens, then it releases a cascade of hormones. And those hormones enable the muscle to become more toned, stronger, more pliable, whatever exercise or whatever protocol you follow, it will, and we have hundreds, it will allow the individual to improve themselves as they see fit.